Good afternoon, everyone. Thank you for joining us. This presentation is provided by our work group, which is Health Equity and Social Determinants of Health. This session is Community Organizing for Health Equity, featuring Baltimore's response to COVID-19. And your speakers are Haley Deutsch, Sandy Noel, and moderated by myself, Carla Valentine. Sandy, I think, okay, great. So as I mentioned, this session is being provided by our work group, which is Health Equity and Social Determinants of Health work group. This group focuses on health equity, social determinants of health, with both a research collaboration and advocacy focus. More specific goals will be established once membership increases, and hopefully some of you will take interest in the work group. Is fairly new. Presentation highlights. During the sessions, participants will gain an understanding of fundamental steps required to achieve community organizing and gain insight on how community organizing was successfully applied in response to the COVID-19 pandemic in Baltimore, Maryland. The goals of the session are to engage in a group level conversation, so please feel free to raise your Zoom hands so we can unmute you, to provide some key concepts that have guided the speakers to working on to this point. We also hope to exchange valuable experiences. Everyone is experts in their area, and we hope to hear some of that exchange go on during the session. And lastly, we hope to inspire an action to call to address the ongoing needs of all of our communities. Our first presenter is Haley Deutsch, who holds a master's degree in science from Johns Hopkins University. Haley's worked over a decade in urban public health, focusing on behavioral health, adolescent reproductive health, infectious disease, food access, and health equity. Haley currently oversees an externally funded program, grants, and externally funded program administration, including Ryan White federal funding for regional hospital-based system in Baltimore, Maryland. Haley also served as a subject matter expert in adolescent behavioral and reproductive health for HHS. Our second speaker for today is Sandy Noel. Sandy is a very well-versed public health professional with over 9 years of experience educating, advocating, and caring for people living with or at risk of HIV at the local, state, and international levels. As the statewide planning and ending the HIV epidemic coordinator with the Florida Department of Health in Tallahassee, Florida, Sandy facilitates the integration of local and state efforts in the planning and implementation of activities to address the HIV epidemic. Additionally, Sandy is enrolled in the Doctor of Public Health program at Florida A&M University to increase her understanding of emerging and re-emerging challenges like HIV and health inequities that underpin underserved minority communities.
Thank you, Carleen. Now I have the pleasure of introducing you all to our moderator, Ms. Carla Valentine. Ms. Valentine holds a master's degree in psychology, public administration, and social change, and is completing a PhD in social psychology. Carleen has over 20 years of experience and background in the field of HIV. She currently serves as the operations manager for an ambulatory HIV primary care and supportive services Ryan White funded program at a large New York-based health system, serving 9 federally qualified health centers, and is the project director and co-principal investigator for 3 grant-funded HIV prevention programs that are funded by the CDC and the New York State Department of Health.
Thank you, Sandy. So now it's your turn. Please tell us who you are, a little bit about your role, or what brought you to the conference. I'm not sure if the poll is going to pop up. If not, maybe you could put it in the chat and I could read off some of the roles.
Don't be shy.
Right, we really don't want to hear our own voices all afternoon. I don't see the poll and nothing in the chat so far, but hopefully our viewers will warm up a bit and share a little bit later. Okay. I think we can go to the next slide, which we probably have to skip because it's another poll.
Okay. I do see something in the chat. Do you see something?
Yes, it is Patty.
Okay.
No worries, Patty.
So I will begin. Greetings, everyone. My name is Sandy Noel. I will start off by introducing you all to the key concepts of community organizing and help you gain an understanding of how community organizing is an effective method for making real improvements in the community, whether it's in person or virtual. Before we get into the fundamentals, I thought it would be best to first define what community organizing is. According to Meredith Minkler, the author of Community Organizing and Community Building for Health and Welfare, community organizing is the process of bringing together members of a community to work towards common interests and address issues that matter to them. It is the work of building relationships and networks in communities, basically to create change through collective effort. Now, the images that I have displayed on the right side of the screen are a few examples of community organizing as we would think about it in general sense. But I do want to say that community organizing can happen in a variety of contexts that define community. For example, community members can come together to develop plans on how a city should be better equipped for the children, or neighbors can join in protests amongst themselves to stop drugs or violence in their respective neighborhood. Or even members of a faith community can join together to work towards building affordable housing because that's just part of what their members and congregation, that's what their needs are. These are all examples of organization efforts. Above all, it requires determination and a clear plan with goals, but also follow through and willingness to compromise in order to achieve community organizing. Now, we wanted to, again, this is not our session, this is your session, this is our session, basically. So in this chat, I would love to hear from you all on what words or images do you think of when you hear the word power, because that's a huge part of community organizing. Carlene, do you mind helping me with the chat as well?
Absolutely, I'll read them off as they come in.
Thank
So
you.
don't be shy, folks.
Right.
I'll volunteer one. When I think of power, I think of large, just like the image, large groups of folks protesting. We have one in the chat from Newberry who thinks of collectiveness.
Yes, that's good.
Jacqueline says money and privilege. Absolutely. Elena says people. Forgive me if I mispronounce people. And then Dawn also shares togetherness.
Those are all great points, and there's no wrong answer. That's just to get you thinking about, people always consider community organizing, but they don't really consider the aspect of power. Which brings me to the next slide. Just for everyone's reference, I wanted to start off with the dictionary definition of power, which is the ability to create, prevent, or shape change. But that doesn't mean your definition of what power is doesn't mean anything, because keeping the definition and your recollection in mind, for example, this image on the left, it emphasizes that people still don't know their true power, which unfortunately is still our reality. People don't know their power. And as a result, I wanted to bring up this quote from Saul Alinsky, who's considered the founder of community organizing. And he basically emphasizes in that power stems from the organization of people to instill change. When Alinsky pioneered like everything related to community organizing, he was interested in how the dynamics of power and the interaction of those who had power, like the haves versus those who were denied power and the have-nots. But it was through his methodology with community organizing that people like our former President Obama, who started his career as a community organizer, he stated in his personal essay about how the problems that affect our community, they begin with the fact that people in our community don't have the power. And it's not just a lack of effective solutions, but it's from the fact that they lack the power to implement the solutions that they don't know that they have. So it stems from building into community organizing, whether it's having specific leaders in your community to bring everyone together to bring long-term power and community organizing.
Before you jump into the next slide, I just wanted to point out two more things that came into the chat because it really resonates with that slide that you're talking about now.
Absolutely, yes. This is an engagement discussion. This is not just me talking.
For sure, for sure. So Julie had offered the influence was one word that she thought of.
Absolutely.
And then Patty has power. We all have it and can use it to affect change.
Yes, and that's perfect because it brings us to this slide. I racked my brain out trying to come up with, okay, what are the main concepts of community organizing? There's too many, but in reading and everything related to Saul Alinsky, he has general concepts, but there's 4 main concepts to community organizing. So that's on this screen right now. So the first 2 that have to do with the specific kinds of power, institutional power and the power of the people. Now, institutional power refers to the control that the institutions have over the way society is constructed and maintained. Like it's like where entities like government and influential corporations, they feel like they have the upper hand to direct people's behavior. Now, and as you know, the heart of community organizing is the people, not institutions. So when people who are affected by an issue or a problem decide and to accept that they need a solution for their problem, it's the strength in numbers and that gives them the strength to put the pressure on those institutions or politicians and whoever who can make those improvements so that they can actually achieve community organizing. So people power is community organizing. The next 2 key concepts on the right side I want to emphasize in community organizing are self-interest and community interest. Many people, for whatever reason, are uncomfortable with self-interest because they see it as a bad thing. I'm low-key selfish, but not all the time, but that doesn't mean that's a bad thing. And I say that because knowing what's your self-interest, that means you're aware of what's your concern for your priorities, your health, your safety. And that includes people that you care about that are connected to you. And the important factor is that it's what is of interest to people individually that motivates them. It's their self-interest. Now, and that brings us to community interest, which is a collective concern for priorities, health, and safety. So it's people individually with their own self-interest, they bring their self-interest into community interest. And community organizing is basically self-interest and community interest motivating people to come together to get power and make change. Now, I do want to make reference to this image on the right side. That is Saul Alinsky. I've said his name a few times. I'll probably say it a few more times, but he is amazing. He is one of those people that fuel this discussion on why we can't just leave it at the institutions. It really has to go down to the power of the people to make effective change. And he views self-interest as the main motivation for political participation in general for community organizing. Now I want to move forward. Are there any questions in the chat or comments?
No questions at this time.
Thank you. So we've gone through defining the key concepts and community organizing in general. And I do want to emphasize that there's fundamental steps to community organizing. And there are several ways to describing the community organizing process. I wanted to make it just short and clean for you all. And these are some basic steps that have been used. When Haley presents what she's done in Baltimore, she'll emphasize what worked for her in that area. Now, I wanted to just group these tasks just to give you all some understanding on how you can interact with the community in your respective areas. Now, to truly understand people and to really see their everyday challenges for yourself, you just need to listen. That's why the first step is the listening process. The listening process involves listening to people to understand their self-interest and to also assess their resources or needs. I mean, you can see on the in the image, I'm a visual, so that this is former President Obama. He is performing community organizing, and he's actually going to the neighborhoods in Chicago just to listen to what people want. That's what he did as a community organizer in Southside. And so this brings us to, after listening, which is an ongoing process, but it's a first step, you need to have that first meeting, because it allows community organizers to not just bring people together, but start and build on what the people know, which is their self-interest. And once they build on what they know and they organize their self-interest, then you're able to reference issues, the common issues that will motivate them as individuals, as a community from the listening process. Bringing people together based on their common interests also gives them a reason to go to the first meeting, because attending a first meeting means they're going to attend regular meetings because it's based off of their interest, something that they're empowered to act on. And I do want to note that having regular meetings is part of the process, and you have to be consistent. It doesn't have to be every week, but if you make it where it's bi-weekly or even quarterly, so that individuals and community members are allowed to come together to collectively work on something, it allows the discussion, the issue, to not just be ignored, but consistently worked on. And I included research because as a community organizer, you're going to be the one to help identify potential solutions. Though it's going to be on the community's call, but it's also your role to introduce, hey, from these interests or issues that you all presented to me, this is what I came about from my research. This is what I learned from other areas. So you bring up you identify potential solutions, community assets, and even bring together decision makers to these meetings to help the community members feel even more empowered to be able to see their solutions solutions to their issues become possible. And next we have action. Taking action with people to solve problems is the whole point of engagement. And it allows not just community members, but collectively community members, institutions, and even decision makers to negotiate, and it even helps community members become more comfortable with confronting the institutions and to give them pressure on what they feel needs to be addressed as far as their priorities. Now, I do want to emphasize this wasn't proposed, but I added the lasting reflection, because after having done all these actions, you need to bring the community back together to reflect on what happened, what went well, what worked, what didn't go well, what we're not going to do anymore. And this also allows them to consider what to do next time. What do we need to do to move the next, or what could be the new issue that we focus on? And it also allows them to consider what outcomes to be hopeful for. This is not on the slide, but I did want to note that despite which steps you take in using community organizing, it's really important to identify the small wins early in the planning process, because successes and the recognition of those small wins can really, they're an added benefit, and they can make a huge difference in how individual community members can feel in the process, because it's a way to not just attract more community members and to be more involved, but also it prevents community members from feeling inactive with producing solutions for their issue. Are there any questions? I know I was just rambling because I'm excited about this.
There are no questions in the chat, but folks can feel free to raise your Zoom hands and we can unmute you, and we can have discussion. This is
okay.
our
Thank you.
You're welcome.
This is perfect. And I did want to know, now that I see President Obama's picture, he actually wrote a personal essay. And in his personal essay, he stressed about how community organizing begins with the premise that the problems facing communities, it results from lack of solutions, but also you cannot achieve community organizing with strong leaders. And strong leaders doesn't mean one or two leaders who are willing to step up, but it just means someone who can knit together and bind community members to continually listen, meet, and continue to act on whatever issue that they feel like they needs to be acted on. So another point I did want to make is that it is possible for certain issues to seem impossible to change, or it might require some long-term solutions. So the solution for this type of issue will be coalition building. I know many people usually mix those two words or phrases, but they really are one and the same. Coalition building just involves organizing multiple entities together, both private, public, to address larger problems at multiple levels within a community. And given the varied structures of community coalitions, members often agree on like one main mission or goal or vision, and that's what guides them to fulfilling the goals and actions for community organizing, coalition building. This brings us to our next poll. From what I just said thus far, how do you all feel about community organizing? Just we'll put a 1 in the chat if you're not comfortable or you still feel unfamiliar. 2, if you're somewhat comfortable or you have few ideas. 3, if you are comfortable and you've had some experience in community organizing, which is great. And 4, you're very comfortable, you've done this, you will continue doing this, and you're just a pro.
And you can also raise your hand and we can unmute you. We would love to hear from you, some of your experiences, your thoughts. Any feedback is valuable. We have some 1s in the chat. Great info. 433, couple of 3s, couple of 4s. Christian says, thank you, Sandy, for a wonderful overview. Looks like we have a good mix. Looks like we have a good mix in the room.
Well, thank you. I just wanted to ask because we'll never be full experts really in community organizing because you're bound to learn something from someone, and all it takes is linking together with someone. And that brings me to my next slide. In simple terms, this quote is about how it's much better to bring things together than as pieces. This quote reminds me that what one can do can be better with other people. So it just emphasizes why community organizing exists. Community organizing, it happens when ordinary people like us work together to bring others together. So in addition to helping making positive changes, you just have to be comfortable with being uncomfortable. So it might be where you might have previously said that you don't have the grasp of community organizing, but coming to this session was one step. So by formalizing the process, whether there's a formalized process or you just join a group in your local area on any issue, there's bound to be a way for you to achieve community organizing. I just want to pass the baton now to my colleague, Haley Deutsch.
Thank you, Sandy. Thank you. As you can see on this slide, you can again raise your Zoom hand at any time if you have questions. And you can answer this question about sharing an experience where you learned something valuable from the community that you served in the chat if you would like. If we could go to the next slide, please. Good afternoon, everybody. I just wanted to thank everybody for joining us today to talk about this subject. And I will be presenting one example of community organizing with a large organization in Baltimore, Maryland, in the United States. Before I begin, I just wanted to acknowledge the debt of gratitude that I have towards my West Baltimore community. They were the ones that led this process, and I really learned from everybody there. I'm not a native Baltimorean, so I've been here for about 13 years, and I am still learning along the way. Next slide, please. So the picture on the right here is a picture of the campus of Sinai Hospital, which is in West Baltimore, again in Maryland in the United States. The neighborhoods in West Baltimore are historically disenfranchised and marginalized neighborhoods. They have not received the level of political or monetary support that other neighborhoods in the city or in the state have received. So at the beginning of the pandemic, in the late winter and early spring of 2020, Baltimore City, in particular, these neighborhoods in West Baltimore, had some of the highest rates of positivity, hospitalization, and mortality in the state. And now, obviously, we're still in the middle of this pandemic, but Baltimore City sustains higher rates of vaccination and lower rates of positivity than the majority of the rest of the state. And what changed there? Obviously, there are many facets to this. Solid public health policies and enactment and enforcement of those policies is one of them. But robust community organization was a major aspect to this. The outcomes that we see now would not be possible without community organization. So my question that I'll be answering today, or starting to answer, is how can large organizations like hospitals assist in community organizations? The key word for me here is going to be assist. If you could go to the next slide, please. So what we see here on the left is the way that many large organizations, including my organization, including hospitals, have approached community building or coalition building in the past. And then what we see on the right is the way that we are looking to do it going forward. So on the left here, we see that formal coalition building is approached often in a hierarchical top-down manner. So the large organization, the hospital or the university or whatever other organization, holds the power, and they are seen as the expert. Or they style themselves as the expert. Only certain individuals, such as leadership in that large organization, can affect change. And partnerships that were made with the community were formalized through MOUs, grants, contracts, etc. If we go to the right, what we are trying to do now is the organization itself is a community member. So representatives of the organization and employees go to community meetings. They live in the neighborhoods, they walk around in the neighborhoods, they patronize community businesses, they go to community restaurants. So power is concentrated in the community itself rather than the organization. We view community members as the experts on their communities and lives. And then connections can be made by any community member, organization, employee, not just leadership. So we saw during the pandemic, for example, our infectious disease doctors who were not previously very involved in that process were going out into the community, going to community events, going to people's homes. So that's just one example. Our environmental staff were doing the same thing, going out into the community, going into people's homes. And a very important facet of this that I want to touch on is that the large organization acknowledges prior harm. So these organizations have usually been in the communities that they've been in for a long time. Sinai in particular has been in that community since the late 1800s. And in that time, whether we want to view it as intentional or non-intentional, harm has been done by that organization in some way to the community. So part of rebuilding trust in the community building process and in the organization itself is acknowledgement of that prior harm. And that can then begin a rebuilding process that centers the community. Next slide, please. So this picture on the right is a real picture from my organization. This is a hybrid community-based and hospital-based team called the Clean and Green Team that does environmental projects within the West Baltimore community and within the neighborhood of Park Heights in particular. So we operate based on what's called a results-based accountability framework, which I know some of you have heard of. Basically, what that boils down to is be where you said that you would be, when you said that you would be there, do the tasks that you said you would do, acknowledge and evolve when things go wrong or don't work. Again, reiterating, being an active part of the community. I live in West Baltimore. I live within walking distance of my hospital. It's not always the best idea to walk there given the conditions of our sidewalks, but I do live where I work, and that was something that was very important to me, and I know many of our employees live in the community as well. Supporting mutual aid and community projects. So these are community building and trust building processes that show that the organization is invested in the community itself beyond what the organization can get out of that community or beyond just results. Mutual aid in particular in Baltimore is something that is very popular and well supported within our community. So having the organization kind of formally support those projects or throw its economic backing behind those projects has been very important. Again, putting egos aside and understanding and acknowledging mistrust that the community may have for the organization. So from talking to the community, I know that there are a variety of reasons, and I'm sure that I will learn more, that individuals do not trust our organization. And acknowledging those helps us, again, move forward and rebuild that trust. Next slide, please. So this picture on the right is a very dramatic picture of our mobile care unit. This is really a great example of how we trusted the community to identify real-world problems, as well as lead in the solutions to those problems. So large organizations can support and amplify existing community networks monetarily and politically. So as a large organization, we do have a lobbying presence within the state and federal governments. And we can use that to advance policies that are important to the community. The example that I'm using from Baltimore today is that we had heard from top down, from the state and from the federal government, over and over again about vaccine hesitancy. So, people didn't want to take the vaccines. That was, people needed to be educated on what the vaccines did. However, when we talked directly to our communities, they actually expressed a strong desire to have access to the vaccine, but there were barriers to that access, including transportation, lack of PTO at their jobs, hesitancy to enter medical settings during an active pandemic, and social isolation. So the solutions to these barriers included working with churches and other trusted community organizations to serve as vaccine sites or as health fair sites. These are accessible by public transportation. They are less risky than hospitals or doctors' offices, particularly during the pandemic. And again, we can offer other screenings and testing at those sites as well. So this mobile health unit was instituted during the pandemic. It is fully grant funded, and it was instituted to bring care directly to clients' homes. So not only do we go to the health fairs that I mentioned, hospital events, senior centers, we go directly into the neighborhoods and go to people's homes. And that's been very important in ensuring access for our community for the solutions that they wanted to see. So they wanted access to the vaccine, and we used the influence and economic backing that we have to bring those solutions to the community. Next slide, please. So these church partnerships are extremely important, particularly within Baltimore and within the United States in general. Churches, and particularly churches within Black communities, have been sites of community organization for decades. Not only are these institutions that are generally trusted by their communities, people feel safe going there. There's a lot of different types of people that go there. They have already been doing the community organizing. So if we as a large organization are willing to take a back seat to that, and understand the importance of churches to their communities, let them lead the way, that ensures that we will have successful, or as successful as results can be. So the examples here, Clergy United for the Transformation of Sandtown. Sandtown is a neighborhood in West Baltimore that is in the Sinai service area. Again, it is a historically marginalized neighborhood, but CUTS, as they're called, is a 12-member organization comprised of faith-based entities in West Baltimore. They've each individually served the community for many years with food access, housing, and economic development initiatives, including lobbying and advocacy for living wage jobs. They came together during the pandemic to advance common goals and to build power. So Sinai partners with these organizations to strengthen this mission. The churches host and publicize vaccine clinics, health fairs, testing spots, etc. Again, individuals may be more likely to use a church as an access point to services rather than come to the hospital, particularly during a pandemic. And the church and the hospital can refer back and forth. An example of this is congregations can be notified when individuals are discharged from hospitalization, from inpatient hospitalization, and they can support these individuals with food, with money, with job support, anything like that. The Black Church Food Security Network is a wonderful organization, and I suggest that everybody check it out after this presentation. It was started a couple of years ago by the Reverend Heber Brown in Baltimore. It is now a national level network. The churches involved may have individual gardens or even farms connected to their congregational properties. Hospital employees volunteer on these farms, they assist with shipping logistics, they spread the word. Food access and land sovereignty in particular are consistently mentioned as critical issues for our communities. So our support of this, of the Black Church Food Security Network has been really integral to our efforts to assist in community organizing within that West Baltimore community. Next slide, please. So barbershop and other community business partnerships. The picture on the left is of an individual sitting in a barber's chair receiving a temperature check from another individual. So like churches, barbershops are natural community gathering spots. Barbers are trusted by their clients and by the community. So we have a partnership called Live Chair that was started by barbershops themselves. With the onset of COVID-19, the company moved to offer infrared temperature checks, as you see here, that send, they're connected to text recommendations that are sent directly to the client's mobile phone. And we set up a kiosk at each of these barbershops that have questionnaires and other information. So if your reading is high, you can get information about what that means right there at the site. For Live Chair, the support of LifeBridge means, again, additional monetary support and education and connections that they can offer directly to their customers. And LifeBridge also gives these organizations testing and screening tools like the thermometers that you see here, as well as PPE. These COVID-19 tools will be implemented in a first phase. And then as the pandemic hopefully continues to wane, they will offer chronic disease testing and support. So blood sugar testing, blood pressure, things like that. The partnership has allowed Live Chair to expand to more barbershops across both Baltimore City and Baltimore County. And again, it has enabled us to bring another means of access to care for individuals who maybe wouldn't come into the hospital, under other circumstances, particularly men who have, not always been interested in coming to the hospital to get screening for things like prostate cancer. So it's just been a mutually beneficial partnership that's really based in the community and was started by the community itself. Next slide, please. So the community health workers, this is on the right, a picture of some hospital employees, including the CEO of our system, in the cafeteria of Sinai Hospital. This was the day that we discharged our 100,000th patient. So community health workers are hospital employees, but they are integral to hospitals in particular that are interested in coalition building. Our community health workers have been at Sinai for decades. They do a variety of things. So they do a home visiting program for new parents, care management for chronic conditions, care coordination for high-risk patients that are coming into the emergency department a lot. We have a diabetes medical home extender program that also offers direct home visits to patients with poorly managed diabetes. And we have a lot of substance abuse programs, such as our overdose survivors outreach program and other peer advocacy programs. And so those are all run by these community health workers. They can also now, they go to people's homes on that mobile health unit, and they are able to talk about ways to both prevent and treat COVID. So they're able to connect people with resources that they need, and in particular, pandemic-specific resources. And representation in leadership is very important. Again, I want to say that this is something that the hospital itself is working on. Obviously, many healthcare organizations, in the United States, representation at those top levels of leadership in the C-suite is not representative of the communities that we serve. So that has to be a goal of hospitals in mind going forward. And as we've hopefully seen throughout this presentation, hospitals and communities can help each other. It has often been in adversarial relationship in many aspects. But the COVID-19 pandemic, although it has been horrific in many aspects, it's been very difficult for both our hospital employees and for our community. But it gave us an opportunity to completely rethink the way that we did community organization. And moving forward, we hope that it can serve as a model for other hospitals in their communities as well. Next slide, please. Okay, so Carlene, I don't know if you want to talk about this slide. I am happy to take any questions if you have any questions for Sandy as well, or just any general questions. If you want to share experiences that you personally have had with community building, just raise your hand or put your question in the chat, and we can help you out. Thank you.
Ladies, let me just say that was an amazing presentation on the listening end. It was really nice to hear that come together. I did want to ask if Donna wanted to contribute. I saw that she had a hand up, but I missed it. I don't know when the hand went up because we have quite a few attendees, which is great. So Donna, if you wanted to participate, I'll be glad to unmute you. Let me see if I can do that now in case. But also if anyone else has, similar experiences, the idea with this session was to have a conversation with our communities about different ways that we've been able to contribute, that we've been able to organize. So it would be great if other folks had any experiences to share. I can speak to an experience that I had when I was working at, I was working for one of our prevention programs years ago in the Bronx, and I'll try to keep a very long story short. We had a team of outreach peers, all of whom lived very close in the communities that they worked with, and they were tasked with distributing condoms and HIV prevention education materials. And that building of trust over time, consistently, as Sandy and Haley both discussed, how important those are. Over time, that trust was built to the extent that they were then, the community began to ask for services to come into their barbershops, hair salons, nail salons. And so that prevention education upscaled in those businesses in Baptist Church. And then eventually the program grew into being able to offer HIV testing in the community, not because that was our goal, but because that was what the community asked for. That was an amazing thing to watch unfold. Being able to organize as a community member within your own community. And then later we gathered those folks into a coalition so that they could meet each other, support each other, recognize and acknowledge all of the amazing things that everyone was doing. We gave certificates. And they were able to share stories about how they were able to help us, the program, reach the goal, reach the community in various ways, with respect to different cultures and, different cultural norms and all of those nuances that you would never know unless you asked or you got that feedback from the community. So that was my experience. There's a couple of things in the chat. There's a question from Rhonda. Miss Haley, how long has your organization been in existence?
Sure, so thank you for the question. Sinai Hospital itself was founded in 1866, so it has been in existence in some form for quite a long time. One of the interesting things about Sinai is that it was actually founded as a response to doctors and nurses who, for racial or ethnic reasons, were not allowed to practice and have admission privileges at Hopkins Hospital. So it was founded in response to marginalization, and it serves a marginalized community. So it has been part of that community for a very long time. And obviously the community has changed somewhat and the hospital has changed in response to that. I have been with the organization for, this is my 6th year. I did not start in the role that I have. I kind of worked my way up the ranks. So as I have done that, I have been supported by the community. And so it's really been important to me to use the leadership position that I have now to amplify the voices of the community that brought me here.
Thank you, Haley. We also have a comment from Donna, who I apologize, I was not able to unmute. Donna says, hello, I am a therapist / healthcare provider and writer in Texas who helps many marginalized individuals find resources for mental health and brain injury needs. I love all this information. Thank you so much, Donna.
Thank you, Donna.
And Ms. Rhonda says, thank you for your response. So we did leave the last few minutes for the group just to have a conversation, ask questions, share stories. We do have one last poll before we end, but hopefully we were hoping to have some more, experiences shared, because we don't read any of these how-tos, do not come in textbooks. If we're lucky, we get a presentation with some folks who can share some real experiences. But outside of that, I think we go in, we make mistakes, we learn, we evaluate, like our lovely presenters explain the importance of really reflecting and evaluating what did we come in to do? Did we achieve what we sought out to achieve? Did we reach the people? Did we ask the people, was our service helpful? Right? Sometimes that happens and we have to get that feedback. Haley.
Carlene, it looks like there's another comment in the chat as well from Kimberly.
Okay, let me get in here. Okay, we have a bunch of thank yous. Okay, Kimberly says, I'm a social worker at a rehabilitation hospital, but community organizer at heart. I think most of us are. I've done a lot of community through the PTA in my kids' elementary school, through high school, everything through organizing after-school programs, transportation, anti-bullying events, and many more. I know there's a room full of organizers here, I'm sure of it. We have a thank you from Newberry, a gracias from Melissa. We have a thank you from Dr. Rana, that this was excellent. Thank you so much for your comments, everyone. No worries about typos, the chat box. We have a, I'm going to attempt the pronunciation, forgive me, Trulicia Newberry says, I served as a Dreams offender from 2013 to 2018. And we did a project one time centered around Lamoaki.
Immokalee farm workers.
Thank you. There you go. Farm workers and economic justice work, and it was definitely a transformative experience. That sounds amazing.
Phenomenal, yes.
I can only imagine. It really is so critical to get on the ground with folks. If now we'll never understand from behind the desk. We have to get out there.
I do want to state that don't be afraid, because I know especially with COVID, a lot of things are, as we're experiencing right now, virtual. Like even last week, for the first time, me and this group, we used something called StreamYard. You have to have access to it. It's paid. But anyways, it's a way to stream from one. You can stream on everything on all platforms. So it was a way for us to expand our community forum to make sure that community members were organized through YouTube and Facebook. And it was we had a great discussion on ending violence. So definitely talk to the community about how do they want to be reached? Do they feel more comfortable on YouTube, Facebook? Is it in person? Because there are people that just want to meet at the community center. So definitely gauge to see how you can bring everyone together.
You really nailed it, Sandy, because we have a CAB, a community advisory board that is largely older patients that have been around for quite some time. They're really valuable to us. And during COVID, we could not meet with them because they were not tech savvy. So we recently just reconvened them and they were so glad to get back together. So in person really was important for them and we wanted to respect that. Can you spell the name of that streaming so I can put it in the
Yes,
chat in case folks
StreamYard,
wanna listen?
StreamYard.
StreamYard.
Yes, StreamYard, just how it's said.
Great. I'm gonna have to look into that. That sounds amazing.
It really was good. But Carlene, I put the call to action on the screen.
Okay, fantastic. So call to action. We are hoping that at the end of this lovely session, everyone is as motivated as we are and continue to be. And so our call to action for all of you listeners is to consider what information or approaches that you've obtained today might you take back to your communities or might you introduce to your communities? How could you introduce community organizing or coalition building? If some organizing is already happening, can we level up to coalition building? Hopefully you've taken some great tips and experiences from the session today and can go back to your communities and do some of this on the ground work because we are all community organizers at heart. We wouldn't be in any helping fields to any capacity if we weren't. I truly believe that. We also wanted to invite all of our listeners today to join us. We are recently reestablishing our health equity and social determinants of health work group. On the screen, and I'll put in the chat, is our email. It's just an email to HESDH+subscribe@groups.io, but I'll put it in the chat. For anyone who wants to join, we'd be glad to have you. We are working on some of the areas that we discussed in our sessions, and we're always looking for more minds, power in numbers, as we say.
And Carlene, she mentioned this last week, but I just want to emphasize, if you're planning on community organizing and you are stuck, just join this group. We're great I love helping people brainstorm. But you don't have to have a plan per se. If you're thinking about doing something in your community, join this group and we could be a platform as far as this work group.
And I'm seeing a lot of responses in the chat, so I wanted to thank everybody for sending us those responses.
Yes.
And again, I just want to reiterate that this we really want this group to be open to everybody. As you can see, we all have very different jobs. We're not all researchers. Some of us, and that's reflected in the existing group membership as well. So we have individuals with lived experience with HIV. We have individuals with lived experience of other conditions. We have researchers, academics, people working in healthcare, people working in community advocacy. So it's very important to us that we are able to maintain that vibrant community that we're working with already.
Yes, thank you so much.
I'll just share briefly some of the comments in the chat. And thank you everyone for your feedback. We really do appreciate it. And thank you, Patty, and everyone for helping us to put this together. We do appreciate it. I would definitely like to use some of the core strategies to apply them to my new role because I'm doing direct service with youth in the Chicagoland area. The International Conference on Stigma is a result of coalition building and community organizing, absolutely. Although my institution does not have a clinic, during the big flood last year, we worked to provide the first service for victims in refugee camps and ensure access and availability of ARVs for people living with HIV and AIDS by mobilizing all potentials, such as community organizers, volunteers, peer support groups, health workers, and the Indonesian Red Cross. That is amazing.
That is amazing.
Ms. Rhonda says, thank you all. Christian says, thank you, Sandy and Haley, for sharing your amazing work with us. We have learned from the session. 1, acknowledge prior harms had been done to communities. 2, deferring power to the community by recognizing they are the true experts. These are such important lessons that can help guide us in the work that we do. I couldn't agree more. And Dr. Rana says, I commend Patty and Cynthia for doing an outstanding job, and we concur. And I guess that is concluding our session unless anyone else has any questions or other comments. Thank you everyone for hanging out with us for about an hour. We appreciate your time.
You have a good one. Enjoy the rest of this conference. Today was amazing, and
Yes.
yesterday.
Sure thing. Lots of good sessions.
Thank you, everyone.
Thank you.
Thank you, everyone. Bye.
I'm trying to figure out how to leave. Okay. Stop.